Hi, good morning.
Hello.
Morning, Emily, how are you?
I'm very well, thanks. How are
Great,
you?
come and have a seat. I'm Dr. Sharif.
Thank you.
How are you doing today?
Yeah, really well, but I need a bit of help. I just wanted to come and have a chat with you, really. I'm 14 weeks pregnant.
Good, congratulations.
Amazing. We had IVF, so third round, and here I am, 14 weeks. The only slight issue is I'm on 5 milligrams of olanzapine.
Okay.
And my partner is very keen for me to be stopping medication.
Okay.
But I'm a little bit worried about it because my mental health has been very stable for a long time, and I don't really want to stop it, but there's quite a lot of pressure from the other mums who keep telling me you shouldn't be on medication, so I've started to worry a bit myself.
Okay.
And yeah, that's why I'm here today.
Okay, so you're 14 weeks pregnant, you're on olanzapine. I can see from your notes that you're on 5 milligrams of olanzapine, is that right?
Yeah.
Good. How are you getting on with it? Is it
Yeah,
all right?
really well. I've been on it for, oh my gosh, probably about 6 years now. It's not been an issue at all.
Yeah.
No side effects. I tolerate it very well. I think I've got used to it. But the main thing is my mental health has been really stable because
Good.
Before I had that, I was quite poorly. I don't know if that's on my records.
Yes, I can see. So this was a few years ago when you were poorly. You were admitted in hospital at the time.
Yeah.
Do you remember what was happening with you at the time when you were admitted? Do you remember what precipitated that?
Not really, because I think there was just kind of a gradual decline in how I went, and obviously my family were really worried, and then it got to the point that there wasn't an option but to be going into hospital.
Okay.
Yeah, I can remember I started to not sleep and I had really bad anxiety, and then I started to have some really unusual thoughts, and yeah, I don't want to be going back to that, which is why I'm worried. But my partner's she really would like me to be stopping the medication.
Okay. Have you had a chat with your partner about the medication at all, and does she know why you're on it?
She knows that I was unwell, but ever since I've been with her, I've been so well, so I've never really felt the need to speak to her in depth about it. So I guess she doesn't know as much as she should know.
Do you think that would help?
I guess she needs to understand why I'm so worried about stopping it, but I just don't really know how to have the conversation with her.
Okay.
Because I didn't tell her, that I'd been unwell to the point that I was in hospital.
Yeah.
Yeah, but...
Is there a reason why you haven't had that conversation with her yet?
It's a time of my life I didn't really want to remember, and because I've been well for all this time, it's just never, it's never been an issue. I've never felt the need to speak to her about it. So I guess when I got pregnant, I should have been thinking about it, and now it's come up. So
okay.
I have no choice.
Well, it's good that you're thinking about it now, and it's great, that you're here to talk to me about it. Yeah. I was just sort of flicking through your notes as we were having this conversation. I can see you've been compliant with the medication for as long as you've had it, right?
Yeah.
Yeah. I can see all your sort of checks, annual checks that are required, your sort of physical health checks around this have all been done in a very timely manner, and they're all good. Your height, your weight, looks like your blood pressure is good as well. All the bloods that we've had to do, they're all absolutely fantastic. You say you haven't had any side effects?
No.
Yeah. Good. And you've been stable on this, so you're holding down a job, is it?
Yeah, I'm working. I know that the medication is helping me, but my life I have no difficulties in any area of it. I work, I've got my partner, I'm pregnant now, we have our house, we've got a good support network, so
brilliant.
These are all good.
Yeah, these are all very reassuring things. And over this this period of time, have you sought any other sort of support to help you? You say that you're stable, which is fantastic. Have you had any other support to help you along the way? Any sort of counselling or CBT? It was just the medication?
Yeah, it was just the medication at that point in time, but I have started to read bits, but I'm a little bit worried about doing that because my partner doesn't think that I'm going to need help, but I'm starting to realise that now that we're talking about stopping medication, it's started to worry me. Okay. I don't want to be unwell again.
Has she talked to you about why she wants you to stop the medication?
She's worried about it affecting the baby.
Okay.
You see all this stuff, don't you? They don't even want you to take paracetamol when you're pregnant. So she's worried that because it's an antipsychotic, and she's read the leaflets that are in the box.
Okay.
That's why she's said that I should. But I wanted to come and see you first just to talk about it, because I...
Yeah. So, I mean, you know, with any medication, there is a small risk that some of it can pass through the placenta, you know, to the baby.
Yeah.
But when you look at the sort of British national formulary that we have, and we use this as guidance to decide on whether we can prescribe medication or not in, you know, all people. So when you're pregnant, there's certain guidelines that apply. You know, if someone had a problem with their kidney or their liver, certain guidelines would apply.
Yeah.
And as clinicians, we wouldn't necessarily prescribe medication if there was going to be significant harm to an unborn baby.
Sure.
And when you look at the sort of guidance on the British National Formulary, it says if the benefit of prescribing this medication outweighs the risk, then it's okay for us to prescribe this.
Okay.
And of course, if we were to stop this medication for you, you've been on it for a long time, you've been doing well on it, no side effects, it's kept you stable. If we did stop it, there would be a risk that, you know, you may relapse, and by that I mean the symptoms that you had before that necessitated an admission into hospital might come back.
Yeah.
And as you rightly said earlier, sometimes these can be very difficult to recognize, and you know, we want to be as proactive as possible in managing your care, and we don't want to be in a situation where, you know, you're just about to give birth, or you have given birth and you're looking after a young child, and you have that sort of relapse, or you experience the psychosis, the symptoms commonly associated, you know, around with these kinds of conditions, that would then necessitate an admission for you into hospital.
Yeah, and that's what I don't want. So that's why I wanted to come and speak to you, so I can carry on taking the medication. And I guess that's what I need to be doing, that I just need to try and explain to
Okay.
my partner.
Would it help if we had that conversation together? Would you like to bring her to a consultation? So, you know, if she's got a list of questions or concerns, then I'm happy to answer them for both of you. And then you can make that sort of informed decision as to how you'd like to proceed.
I think that would be really good, because I think just hearing it from a doctor might reassure her a bit more. So that'll be a great idea. But in the meantime, I'll start talking a little bit more about the reasons why I want to stay on the medication.
Great.
Okay.
And I think it's really good that you do have that social support. You said you've got a good network.
Yeah.
And there's other things that we can do to help you as well, just to make sure that you remain stable. So there's counselling we can offer you. There could be CBT. There's other sort of group sort of support that we could offer you with this as well.
Okay.
And then I think, because, you know, this is a baby that you've obviously tried very hard to have. You're still in the very early stages of pregnancy. So ideally, we should have a specialist, the sort of specialist perinatal mental health teams that we do have locally.
Okay.
They would be able to provide you with that specialist support that you need.
Brilliant. See, this is the thing, when you try and find out information on the internet, you never really know where you should be going. So I'm really glad I've come to see you today. It's been really helpful.
Great, no problem at all.
Okay.
So would you like to speak to our receptionists and book that appointment? And I'd recommend you come in sooner rather than later. Okay. And if you could book that appointment, come in and see me. We can then take things from there, and I'm happy to answer any questions both you and your partner might have.
Brilliant. But that's with the understanding that we try and stay on the medication.
Sure. Yes, I think the aim essentially would be to make sure that you remain on the medication, to keep you stable, to stop that relapse from happening, and, you know, to stop those psychosis type symptoms from arising if you do stop the meds.
Brilliant. Okay, I'll go and book an appointment at reception, and then we'll see you in a few weeks.
Wonderful.
All right. Thank you so much.
No problem.
Bye-bye.
Bye.